So there is a fascinating new study out from a libertarian think tank who decided to take a look at what all the fuss was about when it came to single payer. Now liberals are out there saying, progressives actually, they're all talking about how Medicare for all is fantastic, single payer. And so these libertarians really wanted to take a look and see what it was all about. Now, of course, that leads to the most cited criticism for single payer is that, sure, hey, look, guys, it sounds nice. Everybody gets health care, and it's all fantastic. But God, it's so expensive. So how are you going to pay for it? I mean, you guys are just talking about unicorns and puppies and rainbows and all that stuff. Also Venezuela, right? So now the folks over at the Mercatus Center at George Mason University decided they would take a look at the numbers, right? And see how much more single payer would cost. And that is the assumption, how much more we would end up paying. Right? So now they found that the bill would cost an estimated $32.6 trillion over the next 10 years. So that's about $3.2 trillion every year for single payer to make sure that everybody's covered. The immediate reaction is freak out. Oh my God! $3.2 trillion a year. $32 trillion. Oh my God, oh my God, oh my God. That is so much money, completely unaffordable. And it's nothing more than unicorns, rainbows, and ponies. And I'm sorry, we just can't do that. America just cannot afford single payer. And did I mention Venezuela? Now, of course, in reality, they've already come up with that $32.6 trillion number or around there, and that gets cited all over the media. That's nothing like that's the only thing the media is talking about. They're not talking about anything else when it comes to the plan. Other than, oh my God, it's expensive, how are you going to pay for it, right? However, what is not getting reported on this, at least by mainstream media outlets, is that, look, we already knew it was going to cost that much, and in reality, that's actually going to save us money. In fact, the report found that under Sanders' plan, overall healthcare costs would go down. We would actually spend less on single payer, and as a side effect, wages would also go up. But wait a minute. Now, again, you don't hear anything from mainstream media about that because they're going to gloss over that. They've glossed over it before. They've also glossed over the fact that Bernie Sanders actually has a plan to pay for this, and is a very detailed plan. And he's over here saying, well, actually, we do have a way to pay for it. While the media is going, how do you pay for this? How are we going to pay for this exorbitant, gigantic sum of money that is actually less than what we're paying as a country now, and we're getting less for it. How are we going to pay for it? And Bernie Sanders is like, here's how to pay for it. I have the papers right here, right here, right here. It's frustrating. But anyway, let's go into the details here. And this is from an article in The Intercept written by Ryan Grimm and Zed Jelani. So they said that senior research strategist Charles Blahouse, who authored the paper titled The Cost of a National Single-Payer Healthcare System, estimated that Sanders' Medicare for All plan would yield a $482 billion reduction in healthcare spending, and over a $1.5 trillion in administrative savings. That is about $2 trillion less in overall healthcare expenditures between 2022 and 2031 compared to current spending. And by the way, current spending, it assumes that healthcare costs won't go up over the next 10 years. This is the current spending, so if we switched over right now, immediate $2 trillion in savings. Now, this is an incredibly conservative, not politically, although you could argue that the reason that they had such conservative estimates is because they were looking at it from a political angle, but numbers-wise, right? And as I said before, Jelani and Grimm, they do a great job breaking it down. So first, they dive into how Charles Blahouse, that's a funny word, from a guy who has a last name Waldorf, okay? Insert your jokes here. So they go into the numbers, right? Now, Blahouse first looked at how Medicare for All would lower administrative costs and provide savings in areas like drug spending. So he concluded that by empowering the Secretary of Health and Human Services to negotiate for lower drug prices, this is something we've been talking about. This is something that Bernie Sanders has been talking about. Oh, hey, let's, let them, I'm sorry. So let's let them negotiate drug prices for Medicare. That would actually save lots and lots of money. That's something that a lot of other countries actually do. Where for some reason we don't is because a lot of our politicians are in the pockets of the pharmaceutical industry. Anyway, they say that doing that would save a lot of money. It would add $846 billion in additional savings over the 2022-2031 period. These savings and others are offset by other certain costs, like those which would come from higher utilization. So basically, they're saying, well, look, we'll save money on negotiating, drug prices with pharmaceutical companies. However, if we do have single payer, more people are going to use it. Now, that actually makes a certain amount of sense. However, I think they grossly overestimate how much it's going to be utilized, but we'll get into that part later. Black House's report also acknowledges substantial benefits to eliminating employer-sponsored insurance. He writes that these changes should increase worker wage net of employer-provided health benefits, while also relieving individuals, families, and employers of the substantial health expenditures they do experience under current law. The report even says that Sanders' bill would serve as a boon to individual states, freeing them from Medicaid obligations, or at least most Medicaid obligations, as that would be eliminated and rolled into a single-payer healthcare system. So you wouldn't have individual programs like Medicaid anymore. You wouldn't have Obamacare subsidies anymore. You would have just a straight-up one-payer, single-payer, the government paying for health insurance and paying for costs, funded by taxes. Now, look, I want to be clear here. This is not a liberal think tank. These guys are not progressives. These guys are funded by the Koch brothers. But it turns out that no matter your ideology, you can't ignore math. And the math on this is actually very, very clear. Now, it gets better. Health policy experts and single-payer advocates David U. Himmelstein and Steffi Woolhander reviewed the Mercatus study, and they found that Black House had significantly undercounted savings that could result from Medicare for All. So this is a pair of single-payer advocates that took a look at the plan, which actually already was in favor of single-payer and saying, actually, no, we could extract even more savings through a Medicare for All system. Let me go through that. The Mercatus Center, they say, their estimates of the cost of implementing Senator Bernie Sanders' Medicare for All Act projects outlandish increases in the utilization of medical care, how much you use it, ignores vast savings under single-payer reform, and fails to even mention the extensive and well-documented evidence on single-payer systems in other nations, which all spend far less per person on healthcare than we do. In a written analysis shared with The Intercept, Himmelstein and Woolhandler writes that Black House's report undercounts administrative savings by more than $8.3 trillion over 10 years. Taking those savings into account would lower Black House's estimate from $32.6 trillion to $24.3 trillion. Now again, Black House is saying, using the most conservative estimates available, and saying that more people immediately will begin using single payer. Will go to the doctor, even healthy people, even wealthier people will be like, I got single payer, I'm going to go to the doctor. Even though I'm not sick, because it's there and it's free. And that's not how the real world works. But even in his conservative estimate, we still save $2 trillion over the next 10 years. There it is. There it is. So even when you try to do the most conservative estimate, you end up saving money. There's more. This is great. Now, additionally, the policy experts also believe that Black House underestimates the savings from drug prices. For example, ignoring the success of the U.S. Veterans Administration, the Canadian government, and certain European governments, they write, have had in negotiating for lower drug prices. If the United States paid European prices, they conclude that you would save another $1.7 trillion off of Black House's total cost estimate, bringing it down to $22.6 trillion over the next 10 years. That is $2.2 trillion per year on healthcare. We already spend 3.2 on healthcare right now. That is an amazing amount of savings. If that's not enough, there's more. Himmelstein and Woolhander also claim that Black House grossly overestimates how much extra care will be utilized as a result of expanding insurance coverage. using Black House's projections, they note that he is essentially arguing that once every American is covered, there will be $100 million additional doctor visits and several million more hospitalizations each year. Now, as I explained before, people who are healthy, people who are wealthy are not just going to go to the doctor because it's free. Nobody likes going to the doctor. I don't like going to the doctor, even though I really wish I had fucking health care. And I'm sure a lot of you are like, yeah, look, even if I had health insurance, you think I'm just going to go to the doctor for like a stub, or a stub toe is probably a pretty bad example of that for like, you think I'm going to go to the doctor for a hangnail? No, I don't like going to the doctor. That's stupid. I'm going to go to the doctor when I'm actually sick, or to do preventative care, which actually saves money in the long run. We're not going to use so much extra just because we have insurance. In fact, healthier, wealthier people, you already do have insurance. So that logic that we're going to have so many more people going to the doctor doesn't really track. Now, from the written analysis from Woolhandler and Himmelstein, said there just aren't enough doctors and hospital beds to deliver that much care. Oh my God, doctor rationing. No. Look, he says, they say the doctor is already working 53 hours per week, and experience from past reforms tells us that will not increase their hours, nor will they see that many more patients per hour. They said instead of huge surge in utilization, more realistic projections would assume that doctors and hospitals would reduce the amount of unnecessary care to those who are currently not getting what they need. That's what happened, they say, in Canada. Doctors and hospitals can adjust care to meet increasing demand, as happens every year during flu season. So, yes, they can do that. And also, if there is a shortage, they could probably also hire more doctors. I'm saying that as well. Now, Jelani and Grimm also note that no surge in utilization had materialized when Medicare was implemented and millions of previously uninsured seniors brought coverage. These are the people who would traditionally, you would think, would go to the doctor more. I mean, especially since they're, over 65, they're older. Some of them might have, health issues and think, oh my God, now I can go to the doctor. Turns out, no, they didn't increase utilization, even though they got Medicare. Turns out, most people don't like going to the doctor unless they're actually sick. I know, crazy, right? The data on that said before Medicare, between 1964 and 1966, there was no increase in the total number of doctor visits in the U.S. Americans averaged 4.3 visits per person in 1964 and 4.3 visits per person in 1966. 64 is, of course, was before Medicare. 66 was after Medicare. Now, maybe that did go up. And actually, you know what? It did. It went up for poor seniors, seniors that didn't actually have insurance. However, the number of visits by healthy and wealthy patients also went down. That balanced the whole thing out. Same thing also happened in hospitals. There were no waiting lists, just a reduction in the utilization of an unneeded elective care by wealthier patients and the delivery of more care to sick people who actually need it. So there's the explanation on that. So at the end of the day here, what you have is a study that may be off by around $15 trillion in savings. And yet, they're still saying that, hey, look, it's still going to save money, $2 trillion about, and also will help businesses and also might actually boost wages. This is a libertarian think tank, conservative think tank. Oops, where's the downside? Turns out there's no downside unless you're the CEO of an insurance company, unless you're the CEO of a big pharmaceutical company. Then it looks like, well, hey, man, tough cookies. You're going to lose out, but there's going to be a lot of people who are going to gain. And, of course, you're going to see the lobbyists, and you're going to see, and you already are, actually, the lobbyists in the healthcare companies, the insurance companies, pharmaceutical companies fight like hell against single payer. But as far as the narrative goes, that, oh, no, $32 trillion, we can't expand, we can't afford that. That's what you're seeing in the media. That's what you're seeing from this story coming out, just a gigantic price tag to try and scare people away from actually wanting and pushing for single payer. And I don't think that's going to work. There's a lot of people now, even conservatives, that are saying, hey, it turns out single payer is actually more efficient. It costs less. And I don't like dealing with insurance companies. Nobody likes dealing with insurance companies. Maybe I'll give the single payer thing a try, especially since right now Medicare is incredibly popular. It's especially popular among conservatives. The voting bloc that votes conservative, 65 or older. They've got Medicare, and it's the same kind of, and you hear them all the time making the argument, we should have the same kind of insurance that Congress has. Well, it looks like Congress has government insurance. Oops. And of course, a lot of them are over 65, so they could take Medicare if they already don't. So it makes sense. And, dollars and cents even. For example, like I said before, we spend $3.5 trillion a year right now. Medicare for all, at its most conservative estimate, is $3.2 trillion. And it turns out no matter your bent, numbers don't lie.